We will do a full head to toe, get in position so that you can see me. All right? So let's give you this scenario. You are called to a 20-year-old or 20s-year-old who was assaulted. Okay? So, scene safety BSI. My MOI is I have a 20-year-old male that was assaulted. I'm going to call for additional help. I have one patient. My partner's going to hold C-spine. Next, my general impression of the patient is I have a 20s male laying supine on the ground. I'm going to check his mental status. Hey, hey, can you hear me? He doesn't respond when you talk to him. I'm going to pinch him. He doesn't respond when you pinch him. So my patient is unresponsive. Next, we're going to open the airway by having my partner open it with a jaw thrust. The evaluator will tell me when I open the airway, I hear gurgling. So I will say, I will then suction the airway out. They will tell you the gurgling stops, and I'll put in an OPA to help keep the airway open. And the evaluator will say the patient accepts it. Next, I'm going to expose the chest, and I'm going to look and listen. I'm going to listen at the mid-clavicular, and I'm going to listen at the mid-axillary. And they will tell you that when you look at the chest, you have equal, clear chest rise and fall, equal, clear lung sounds, but you have bruising all over the chest, and the patient has slow, gasping respirations. So I will say this patient is breathing inadequately, and I'm going to ventilate him with one breath every 5 to 6 seconds with a BVM using 15 liters of oxygen. Next, I'm going to move on to circulation. I'm going to check for a pulse. He's got a radial pulse, but it's weak. I'm going to do a real quick sweep of the body, checking for any gross bleeding. There is no gross bleeding noted. And I'm going to check his skin for color, temperature, and condition, and we'll say that it is cold, clammy, and pale. With all this information, I am now going to call the incoming EMS and tell them that I have a high priority patient. So next, I'm going to see if anybody knows anything about this patient. So does anybody know what happened? The evaluator will tell you that this patient was beaten up by their EMT instructor because they didn't know their patient assessments. Okay, we don't know a medical history though. All right, next I'm going to do a full head-to-toe assessment. Checking the back of the head for decap, BTLS, and crepitation. Checking the forehead for decap, BTLS, and crepitation. Around the eyes for decap, BTLS, and crepitation. The nose, the cheeks, the upper jaw, the lower jaw for decap, BTLS, and crepitation. What do I see? Next, checking the pupils, are they equal and reactive? Checking the ears, the nose for any fluid or drainage. Checking the mouth for any fluid or anything blocking in there. What do I see? Next, the neck. Checking the back of the neck for decap, BTLS, and crepitation. The front of the neck for decap, BTLS, and crepitation. JVD, tracheal deviation. What do I see? Checking the shoulders for decap, BTLS, and crepitation. Working my way down to the top of the sternum. Going down the sternum, checking for decap, BTLS, and crepitation. Fanning my hands out, squeezing the ribs, checking for decap, BTLS, and crepitation. What do I see? I'm going to re-listen to lung sounds. All right, mid-clavicular, mid-axillary, and they tell me I still have clear and equal lung sounds. Next, moving on to the abdomen. Palpating the abdomen in all 4 quadrants for decap, BTLS. Going to check for distension and check for rigidity. Next, checking the hips. I'm going to press in and press down, checking for decap, BTLS, and crepitation. Checking the genitalia for priapism in males, fluid and discharge in males or females. Next, I'm going to check the right upper leg for decap, BTLS, right lower leg for decap, BTLS, right foot for decap, BTLS, and crepitation for all 3, and check to see if he has PMS. Next, checking the left upper leg for decap, BTLS, and crepitation, left lower leg decap, BTLS, and crepitation, left foot decap, BTLS, and crepitation, and checking for PMS. Moving up here to the right upper arm, decap, BTLS, and crepitation, right middle or lower arm, decap, BTLS, and crepitation, right hand, decap, BTLS, and crepitation, and PMS. And finally, the left upper arm for decap, BTLS, and crepitation, left lower arm for decap, BTLS, and crepitation, left hand for decap, BTLS, and crepitation, and for PMS. What do I find? Next, my partners and I are going to log roll the patient, checking his thoracic, lumbar, and buttocks for decap, BTLS, and crepitation. What do I see? All right, at this point, we're going to place the patient on a stretcher, and I'm going to take a set of vitals. I'm going to take a blood pressure. I'm going to take a pulse with rate and quality. I'm going to take a respiratory rate, rate and quality, and the skin once again. They'll tell me my vital signs are blood pressure of 100/80, I have a heart rate of 90, weak and regular, respiratory rate 8 and agonal. On his own, skin is cold, clammy, and pale. So again, my patient is not doing that good. I'm going to load the patient into the ambulance and I'm going to start driving to the hospital. En route to the hospital, I'm going to tell the hospital that I'm coming, and every 5 minutes I'm going to do my ongoing assessment, my PIVF. I'm going to reassess the primary assessment, the interventions, the vital signs, and the focused exam, again, every 5 minutes. Make sure that the hospital knows that we are coming, and I am done with this station. Ta-da! How long was that?